Hello, great nurses. Welcome to the Career Pathways channel, where we guide nurses on their pathway to success. In Module 6 of NUS 112 Physics, we discuss the various measurements and their units with their relevance to nursing practice. Here in Module 7, we want to understand the concepts and principles of elasticity and their application to nursing. As we all know, the circles of success remain the same. Red circles are must-know areas for your examination. Orange circles are good for your clinicals, and green circles ask you to skim through this video at later times. Specific objectives for Module 7 are as follows. We will define elasticity. Number 2, we explain the concept of stress and strain. Number 3, we enumerate and discuss the types of stress. Number 4, we'll define the following. We'll define Hooke's law, Young modulus, bulk modulus, and shear modulus. We'll describe the application of the above in the following. That's Hooke's law, bulk modulus, and the others. We'll describe how they relate to blood vessels, spring balance, shearing force in decubitus ulcers. In fact, this is a possible examination question. What force is responsible for the decubitus ulcer? It is shearing force. Okay, let's continue. Objective 1, to define elasticity. Important note: when you assess skin turgor in dehydration, you are testing for elasticity. If there is a slow recoil, that's equal to 10% fluid loss, and there is need for IV fluid to be given now. What is elasticity? It is the property of a material that enables it to return to its original shape and size after the removal of the force causing its deformation. What is an elastic material? Elastic material, for instance, tendons, arteries, rubber bands, and springs, they allow returning to their original size after a temporal deformation. Non-elastic material do not allow return, and they include clay, dough, etc. Nursing translation: elasticity isn't just about rubber bands. It is why veins snap back after IV removal. Skin rebounds when pinched in turgor test. That is, redistribute pressure to prevent bed sores. Loss of elasticity will result to aging skin, atherosclerosis, or fatal pressure ulcers. Objective 2, we want to explain stress and strain. It is critical to note that stress causes strain. High stress plus prolonged time will lead to permanent deformation, that is pressure ulcers. Nurses break this cycle with repositioning to reduce stress and support surfaces to reduce strain. Stress and strain. Stress: the internal resisting force per unit area within a material when subjected to an external force is stress. The formula for stress is equal to force divided by cross-sectional area. The unit is Newton meters square or Pascal. Strain. Strain is the measure of deformation representing the elongation or compression of a material per unit length. The formula is strain is equal to change in length divided by the original length. It is a dimensionless quantity, so it has no units. This is a critical insight. Stress causes strain. High stress plus prolonged time leads to permanent deformation. Example is in pressure ulcers. We break this cycle by repositioning our patient to reduce stress or give support surfaces to reduce strain. It is therefore essential that you change the position of a bedridden patient at least 2 hours to prevent pressure ulcers. Objective 3, to enumerate and discuss the types of stress. Shear stress is responsible for 70% of stage 3 or stage 4 pressure ulcers, according to this research. If a patient slides in bed, their skin stays put while their bones move. This leads to internal tearing of blood vessels. The first type of stress we have is tensile stress. Tensile stress occurs when force stretches a material, e.g. when you pull a rubber band, you apply tensile stress. Compressive stress. Compressive stress occurs when force compresses a material, e.g. bones under body weight. Shear stress. Shear stress occurs when force causes a sliding layer. Example, bed sores from friction. Volumetric stress. Volumetric stress occurs when change in volume due to applied force causes a stress. Example is pressure in blood vessels. As a form of summary, we want to look at the types of stress, their physics mechanism, and their nursing application, including risk. Number 1, tensile strength. Tensile strength occurs by pulling force, stretching material. Example is skin during a movement. Risk. Suture shearing wound will lead to dehiscence. Action. Use butterfly bandages to distribute tensile stress. So you see that the butterfly bandages you do in the hospital are not just for decoration purposes. 2. Compressive stress. Squeezing force, shortening material. Example, body weight on the bone. Risk. Sacral and coccyx pressure ulcers result from stress resulting from capillary pressure. What should be the nursing action? Tilt the patient 30 degrees and reposition every 2 hours. This will reduce stress by 50%. Shear stress. Shear stress. Parallel forces sliding layers is shear stress. Example, skin versus bone during a sliding is shear stress. The risk. It is most deadly. It causes deep tissues injury before skin breakdown. Example, sliding down the bed will cause shear stress. Action, lift, don't drag your patient. Use trapeze bars. So it is not advisable to drag patient as this could enhance decubitus ulcers. Objective 4, we want to define the following: Hooke's law, Young modulus, box modulus, and Shear modulus. Hooke's law. Within the elastic limit, stress is directly proportional to strain. This is indicated by this formula. 2. Young modulus. Ratio of tensile compressive stress to strain. Stress to strain is Young modulus. It measures stiffness of a material. So take note of that. Bulk modulus. Bulk modulus is the ratio of volumetric stress to volumetric strain. The formula is given as follows: K equals to pressure change, fractional change in volume divided by fractional change in volume. So basically, it is the ratio of volumetric stress to volumetric strain. Important in understanding the fluid and tissues under pressure. Fourth one is shear modulus. Shear modulus is the ratio of shear stress to shear strain. It measures how easily layers of tissue or skin slide over each other. We want to understand these terms we've discussed, their physics definition, and how they apply to nursing. Hooke's law, we said, is strain directly proportional to stress, or stress directly proportional to strain within the elastic limit. The formation is reversible. How does this apply to nursing? Spring scales. Weighing of infants. This is accurate because spring obeys Hooke's law. Overloading will break elastic limits, making the scale to fail and give you a wrong dose. Young modulus. Young modulus explains stiffness. Tensile stress divided by tensile strain. That's Young modulus. High Young modulus shows that the object is rigid. Example is the bone. Low modulus mean that the object is flexible. Example is the skin. How does it apply to nursing? Vascular health. Arteries with lower young modulus, which is stiff, results in atherosclerosis, which leads to hypertension. It is very important to assess pulse lag between radial carotid arteries. Bulk modulus. Bulk modulus is resistance to compression. Is equal to pressure divided by volumetric strain. High bulk modulus results in hard compresses. So when an object has high bulk modulus, it is very difficult to compress. Example, water. Nursing relevance. Bulk modulus is relevant in edema management. Swollen tissue has reduced bulk modulus, which makes it easily deformed, resulting in the use of compression stockings, which will increase external pressure, leading to reduced strain. Shear modulus. Shear modulus is relevant to nursing in that it is important in pressure ulcer prevention. Subcutaneous fat has low shear modulus, which makes them to slide easily, which leads to high shear risk. Action. Nurses should use heel suspension devices. These are memory aid for nurses. E equals to extension, tensile, K equals to crushing, which is compression, and G equals to gliding. So G for gliding, K for crushing, which is compression, and E for extension. So in case you are asking exam, which of these is responsible for gliding force on a patient's skin, shear modulus applies. Objective 5. Clinical application of elastic principles. Elastic principle is applied in blood vessels. Elasticity allows the artery to expand and recoil with each heartbeat. Loss of elasticity will lead to hypertension and aneurysm risk. Application also for number 2, arteries obey Hooke's law. They are stretched during systole, they recoil during diastole. That's called Winkel's effect. Young modulus will increase with age, leading to stiff arteries. What are the nursing actions? Assess arterial stiffness. Delayed pedal pulse plus weak hand pulse will lead to increase in young modulus, leading to atherosclerosis, which lead to high fall risk from orthostatic hypotension. Number 2, prevent vascular injuries. Use low stress tourniquets, elastic limits. Never leave greater than 2 minutes. It will result to nerve damage. So for this number 2, after collecting blood samples or fixing your line, ensure to remove your tourniquet immediately. Don't leave greater than 2 minutes. Number 3, IV site selection. Avoid sclerotic vein having high young modulus. These areas are prone to infiltrations. Also in spring balances, physics principle. Spring balance works on Hooke's law. Weight will stretch the spring proportionally. It is used in nursing for weighing of infants, body weight monitoring, and precise drug preparation. This is proven historically. Nursing action in spring balance. Infant or neonatal weighing. We use digital scales, not spring based. Low mass is below elastic limits, leading to inaccurate reading. Safety check. If spring balance doesn't return to zero, it usually has exceeded its elastic limit. Please do discard to prevent dosing errors. So don't use a spring balance that have lost its elasticity. Shearing force in decubitus ulcer. When skin sticks to the bed but deeper tissues move with body weight, shear stress damages capillaries leading to bed sore. Nursing intervention. Turning patients or using special mattresses will prevent decubitus ulcers. This is a possible examination question. Relationship between shear force and decubitus ulcer. Physics principle. Shear stress is equal to force parallel to surface divided by the area. Causes deep tissue strain even when surface pressure is low. When repositioning, elevate the head less than 30 degrees. If it is greater than 30 degrees, it will increase the shear pressure by 300% on the sacrum. Never drag your patient. Use slide sheets to eliminate shear pressure. Why does elasticity matter in nursing? You don't just see skin, you feel physics. When you assess skin color, you are measuring elastic limit. When you prevent pressure ulcers, you are managing shear stress. When you choose IV sites, you are re-evaluating young modulus. Master elasticity and you turn every touch into a diagnostic tool. Answer this question in the comment section. Why is shear stress more dangerous than pressure for ulcers? A spring scale reads 2.8 kg for 3 kg infant. What physics principle failed? I want to see your answers in the comment section. As I round up, the circles to success are as follows. Take note of the types of stress and areas they apply to nursing. Go through this video again. Orange circles tells us to take note of the practical areas that were mentioned. For instance, for a patient who is usually bedridden, ensure to rotate or change the position of the patient 2 hours every interval. I want to thank you for staying this long for this video. If you have not subscribed to our YouTube channel, kindly subscribe as it tells us how you enjoy our video. Till we meet in module 8, goodbye.